your stem.
Okay.
Yes, next.
Okay.
Next.
Okay.
Right. So if both are ready, should we begin?
Yes, ma'am.
Yes. So if you've read and understood, considering it communication skills station, please begin.
Hi. Hi. Good evening. I'm Dr. Fyong. I'm one of the surgical doctors. I'm calling to speak with the trauma head to update him about the trauma case. Can I confirm I'm speaking with the trauma head, please?
Yes, good evening, doctor. It's Dr. David. Yes, you're speaking to the trauma head. Please summarize your case.
Okay. Patient is a 20-year-old male who presented to the accident and emergency following a road traffic accident. Clinically, he is hemodynamically stable with a GCS of 15, and there is left flank abrasion and the right open right tibiofibular fracture with pulseless and cold extremities. Then on imaging, the available ultrasound showed that there's fluid collection in the paracolic gutter, and the X-ray confirmed the right tibiofibular fracture.
What do you think? Why the patient was initially unconscious?
Okay, I think a patient might have had a head trauma.
Okay, can you please tell me what is lucid interval?
Oh, I think we are in the wrong. Okay. A lucid interval is the temporary phase where a patient gets consciousness, after which there is a sudden deterioration in the level of consciousness, which commonly happens in patients with head trauma.
Okay, and what is the most urgent in this patient?
Okay, for this patient, I'm much more concerned about the likelihood of an arterial injury, as patient's right limb is pulseless and cold, and patient will need urgent surgery.
Okay, and patient also have intra-abdominal collection. What do you think? What takes the first priority in this case?
Okay, I'll do an abdominal ultrasound scan, and based on the findings, I'll get to inform the general surgeon, and then I'll continue serial abdominal examinations, and if there is need for an emergency laparotomy, then I'll let the general surgeon, I'll inform the general surgeon.
Okay, in both of these conditions, what is the most urgent and what takes the first priority? The vascular injury or the intra-abdominal collection?
The vascular injury, because
Why
it's
so?
a limb saving injury. There's risks of ischemia to the limb and also compartment syndrome because patient has open tibiofibular fracture.
Okay, and what are the causes of pulseless foot?
Okay, in this case, it's very likely due to arterial injury. It can also be due to arterial spasm or kinking of the blood vessels, and also compartment syndrome.
Okay, and is the patient wearing a cervical collar?
Okay, I'm very sorry. I don't have this information at the moment, but I'll check back and I'll get back to you.
Okay, is the patient dehydrated?
Okay, I'm very sorry. I don't have that information at the moment, but I'll reaccess and I'll get back to you.
Okay, what would be your plan of action?
Okay, I'll inform the vascular and the orthopedic consultant, and I'll immobilize and reduce the fracture, and then I'll order for CT head brain and CT abdomen and pelvis.
Okay, and what is the missed investigation that you should be doing?
Okay, I'll also do an arterial duplex and a CT angiogram of the affected limb.
Okay, why are you calling me?
Okay, I'm calling you because this patient likely has an arterial injury, and there is risks of the patient losing his limb, and also risks for compartment syndrome, and this patient will need urgent intervention.
All right, thank you.
Okay. What would you be doing before sending the patient to operation theater?
Okay, I'll give IV fluids. I'll give analgesics, and also begin broad antibiotics, and I'll confirm if the patient has gotten tetanus toxoid vaccination.
Yes,
And then I'll cover the wound with a saline soaked gauze, and I'll apply traction to the.
yes, and you'll give antibiotic to the patient. How would you fix the fractures? How would you take care of the fractures?
Okay, I'll like to do an external fixation for the fracture.
Why would you choose external fixation?
Okay, first because it is an open fracture, and also it is going to serve as initial stabilization for the fracture, and allow room for allow easy accessibility for secondary definitive surgical repair for the fracture and the surroundings of tissue.
All right. Why would you be calling or contacting general surgeon?
Okay. There's a likelihood of an intra-abdominal
Yes.
injury.
Other than that,
The open wound, the wound.
okay. Yes, you need to debride the open wound and
Possibility of compartment syndrome.
yes. Okay. For the possibility of management of compartment syndrome. All right, good. Right. You said you'll be contacting how many other departments to take care of this patient? Other
Okay,
than general surgeon, vascular surgeon, and orthopedics, who else would you contact and why?
I'll contact the anesthesia consultant
And
because of the need for surgery.
yes, and
And then the theater or
operation theater, yes, and
the plastic surgeon,
yes. Why would you be needing plastic surgeon?
because there may be need for soft tissue reconstruction.
No, grafts. Grafting.
Grafting.
Yes.
Sorry.
All right. Okay. What blood investigation would you send for?
Okay, I'll send for full blood count, EUCR, LFT, and then grouping and cross matching because of
Yes.
patient will be going for surgery.
And patient might need blood arrangement. Okay, good. All right. You can, yes. All right. You can go ahead and manage the patient accordingly. Thanks. Now the bell went.